Hello, welcome back to my channel. This is Dr. Mukhtar Yarima. Today, let's talk about why depression is commoner in women than in men. A number of studies have found that depression all over the world is commoner in women. It's more likely to occur in women than in men. But why is that? This video is going to try to talk about the factors that have been found to explain the difference in that regard. So let's go right into it. The first factor that is probably responsible for making depression to be commoner in women than men is what we call hormonal changes. In women, there are a number of hormones that tend to vary from time to time in their lives, in fact, almost throughout their lives, with about three distinct periods in which these hormones are more likely to vary. Now, because it is found that women during the times when these hormones tend to vary in their bodies are more prone to having depressive symptoms or depression like symptoms, that led to the conclusion that perhaps this hormonal variation is what partly explains why depression is commoner in them than in men. But before we talk about those distinct periods in which the hormones tend to vary more in women, let's talk about what hormones are. Hormones are minute chemical substances that are secreted from one organ system of the body to another in order to convey information to ensure that normal bodily functions take place. One of such hormones that we're talking about in this case is estrogens. Women tend to have predominance of these estrogens, although men tend to have estrogens in their bodies, but these estrogens are in little amounts in the bodies of men than what you find in women. And additionally, the estrogens in men tend to have a stable course throughout the lives of men compared to the fluctuations or the changes that you find in these estrogens in the bodies of women from time to time in their lives. So, the most important period in which you find estrogens or these hormones to fluctuate or to vary is during the normal monthly periods that women undergo every month. The hormones tend to rise and fall during these monthly periods, and it is the rising and falling of these hormones that bring about all the changes in the normal menstrual cycles of women. The second time in which you find these hormones to fluctuate is during pregnancy and shortly after childbirth. Pregnancy and childbirth are periods in the life of a woman that allows for her body to be able to become receptive to the developing human in her body. Now, shortly after delivery, the hormones levels tend to fall or they essentially tend to vary from what they used to be during pregnancy. And no wonder after birth, some women tend to have some depression like symptoms. And in some cases, they are usually mild. In fact, in most cases, they are usually mild, and that is why even if they are called maternity blues because they last a few days and the symptoms are less intense. But in a few women after childbirth, they tend to have severe depressive symptoms that even led to the diagnosis of depression, and that is called postpartum depression. The third period during which women tend to have changes in these hormones is during menopause. Menopause is a time when women stop menstruating and they stop having their normal monthly cycles. This too is associated with sudden falls or changes in the levels of their circulating hormones, especially the estrogens we're talking about. So, overall, what is thought to be responsible for making women to be more likely to have depression than men is these changes in the levels of this hormone, especially the estrogens, and that's why they tend to have more depression than men. The second factor we're going to talk about is what we call role overload. This is just a fancy word for saying that a woman has a lot of responsibilities, a lot of roles that are expected of her. For instance, you find that a woman, if she's married, she takes care of her family. She is a mother, she is a wife. And then you also find her at the same time, in some cases, keeping a job outside her home. So this takes a toll on her mental health because of the stress that can come from having to juggle all these roles and responsibilities. There are times when you also find the woman having to take care of an ailing or an aged family member because hardly do you find men being responsible or being asked or being expected to take care of aged or ailing family members. Again, in some cultures, especially in Africa, you find that women also take care of their parents-in-law. It is expected that they should be an integral part of the lives of these in-laws. Having to juggle all that is actually a lot of stress, and this might make women more likely to have depression than men. The third factor we're going to talk about that might be responsible for making women more likely to have depression than men is what can be called reporting bias, in which women are more likely to report to hospital when they have feelings of lack of happiness, feeling of sadness, any of the depressive symptoms. They are more likely to want to seek for help. Unlike men who culturally tend to probably believe that going to the hospital to admit that they are feeling unhappy and they are feeling sad, it is considered a sign of weakness, perhaps. So men are unlikely to do that. Instead, what you find is the tendency for men to take alcohol, for instance, or to take drugs, essentially self medicating for these depressive symptoms. It therefore means that women are more likely to be diagnosed with depression because they simply are more likely to present if they have depressive symptoms, whereas men relatively are unlikely to present to hospital for depressive symptoms. And of course, that will now obviously make depression to be more likely seen in women than in men. The fourth factor we're going to talk about is relationship dynamics. Women in relationships tend to be very highly invested. They tend to invest a lot of time, resources, emotions, and what have you in any relationship they are in. Men do invest in relationships too, but probably not as much as women do. So it goes without saying that you are likely going to want to take care of anything that you invest your time, resources, and emotions in. So if a woman perceives that her relationship is likely going to fail, or at the slightest indication that her relationship is not going well, she might begin to feel disappointed, she might begin to have psychological reactions, and that might make her to become depressed. Unlike men, who in most cases are not as invested as women, they might probably not have as much depression as women. The fifth factor I'm going to talk about is what we call unique stressors. Women are exposed to a number of stressors that men do not necessarily get exposed to. Example, in gender based violence, it is essentially women in almost all cases that are the victims of gender based violence. Granted, there are times when men too come under attack of their spouses, but this is the exception rather than the norm. Women are the victims in most cases of domestic violence, of gender based violence. So, because women are oftentimes the targets or the victims of this kind of stressful situations, especially domestic violence or gender based violence or sexual assault, they are more likely to have depression than men. The sixth factor is economic disadvantages and income inequalities that you find between women and men. For the same kind of jobs, women often are paid less for the kind of work they do compared to men. Even when they work the same kind of work, and even if they have the same level of proficiency, the same level of skills, women tend to be paid less. Now, this is not the case in all cultures. There are countries of the world where these gaps are closed. It is nonetheless, however, a factor to be looked at when we're looking at all the factors that explain why women are more likely to have depression than men. So overall, there are a number of factors that make women to have depression more often than men. But the good news, however, is that depression is a treatable condition. There are effective treatments, and the reason why we're talking about this is so that women should look out for themselves, should take care of themselves, especially if they have a lot of stressful situations, if they have role overloads, if they have relationship issues, and all of those factors that we talked about. These are factors that tend to make them more likely to have depression. Thank you.